Welcome, everyone. Thank you for joining us for another Learn to Return Learning Network event. Learn to Return is Washington State's school-based COVID-19 testing program. It's funded by the Washington State Department of Health, advised by OSPI, and implemented in partnership with all 9 ESD regions and Health Commons Project, which is a Washington-based nonprofit. My name is Sarah Sutton. I'm the Director of School Programs at Health Commons Project, and I'm honored to be serving as your facilitator today. Today, we are talking about the emergency proclamations. We all know Governor Inslee announced the lifting of the remaining proclamations, and now we're asking ourselves, what does that mean for Washington schools? So an important topic, and I appreciate all of you joining us for it today for a discussion where we can learn and explore together. So a busy hour per usual. We have a little bit of everything in here. We're going to start with some presentations from the Washington State Department of Health. We're joined today by Dr. Lillian Manahan. She's a surveillance epidemiologist at DOH, and she's going to review the most recent COVID-19 data, specifically around children, youth, K-12 populations. She's going to help us understand what story the data is telling us. Then we're going to invite Kim Sanchez, the K-12 Education Engagement Director from DOH, to share some visibility in how DOH is responding to the lifting of the emergency proclamations. Kim is a key stakeholder in the revision of the K-12 guidance, so she's going to share what she can with us today related to what we can expect around the K-12 and childcare guidance. We've then invited some panelists to provide reflections to the presentation. We have Martin Mueller from OSPI, Michelle Chung from the DOH COVID-19 testing team, and Karina McIntyre, the Regional COVID Response Coordinator for the AESD network. This is not a Q&A panel. This is reflections. This is an opportunity for these state leaders to provide any insights, any additional layers to the conversation. I have not asked them to prepare anything, so it is organic. We then have a couple of school leaders who have offered to help spark our group conversation. School leaders from Highline and Meade, Waterville, and Palisades. They're going to give us some insights into things that they're thinking about, perhaps what they've done to date, what they may or may not change moving forward. Again, this is an effort to spark a group conversation where everybody is welcome to participate however you're comfortable. You can participate in the chat. You can take yourself off of mute. You can raise your virtual hand and I can invite you into the conversation. And then I'll wrap us up at the end. But you'll see with our agenda today, we're moving from structured to less structured. And I think that there's something poetic about that. You know, it's a parallel to what we're seeing with our emergency response, both in Washington State and nationally. So. Quick reminders, closed captions are available. If you'd like to enable closed captions, just go to the bottom of your Zoom screen. There's a little button with CC in it. Again, today is not a day for clear-cut answers. Today is really co-learning, each of us bringing our own unique perspective into the group dialogue. Lily, welcome. Thank you so much for doing this. Would love to pass it over to you.
Thanks so much. My name is Lillian Manahan. I'm an epidemiologist with Washington State Department of Health, and I work in our focus office on the special projects and data requests team. So that is sort of where I sit. We've been doing a lot of reporting on COVID for the past 2 years. So what I'm going to focus on today is the most recent results from one of our weekly reports that we put out. So we have been putting out a report called COVID-19 Cases Among Children and Youth in Washington State for, I think, almost a year at this point. And what this report does is it describes cases among all children and youth in Washington, defined as 0 to 19-year-olds. We split the data up by educational service districts and by age groups. And the way that we broke down the data for this report is we used the home address of all of our cases between 0 and 19 years old and see which ESD that home address falls within. So it does not mean that these data are representative of children that attend school in that jurisdiction necessarily. It's any child that lives in that region. So this report is updated and published on our publicly facing DOH dashboard site weekly. So this first slide is showing case rates per 100,000 population in children and youth in Washington by ESD region. And I pulled up these maps from our last 3 reports that we've put out. So you can see that the highest case rates have been consistently in Eastern Washington over the past 4 weeks or so. And the ESD with the highest rate has shifted around a little bit, but generally we're seeing those darker blue colors indicating the higher case rates in our Eastern ESDs. What this slide is showing is how these 14-day case rates have changed over time. This longer epi curve that you can see on the left, it goes all the way back to January 2021. We can see that big spike in cases that happened in December and January of 2022. This trend closely matches what we were seeing in all age groups across Washington. And then I zoomed in on our most recent data, so starting in midsummer through the start of the school year in September. So we were seeing a pretty steady decline in June through the beginning of September. And then in the most recent weeks, we're starting to see a slight increase. But the most recent numbers that we just put out, we're seeing that around September 22nd, that 14-day rate sort of peaked, and now we're slowly going back down. So we'll have to wait another few weeks to see if that's just a little blip in the data or if we'll sort of plateau, go up, or continue this very slight downward trend we've been seeing most recently. So what this does is it takes each ESD and looks at that same June through September timeframe, just looking at the trends. And as you can see, there is some variability across the different ESDs in terms of what we're seeing with case rates. But in general, in most ESDs, we did see some slight increase in the beginning of September. Looks like ESD 105 is maybe the one exception to that, where it sort of plateaued and a slight decrease. So what this slide is showing is case rates broken down by age group. And I pulled these plots from our 3 most recent reports. So about a month worth of data to see how things have shifted over time and across age groups. And what we have found is that the 0 to 3-year-olds have had the highest case rates statewide for the past month. And similarly to those trends over time, there are differences across the different ESDs. But for the majority of ESDs, we are seeing that pink line, which represents the 0 to 3, have had the highest rates. So this is the hospitalization rate in all children and youth in Washington state. And once again, we get that big peak in January of 2022, which mirrors what we're seeing with the case rates. And then I zoomed in on June through September 2022. And you can see there's a lot more variability in these hospitalization rates. And that's just because we're working with pretty small numbers. So there's a lot more fluctuation even over 14-day rate. But in general, we have been seeing like trending upwards starting in September. And I did see, I think, a question in the chat. Can you define cases, please? Only lab PCR, include antigen, include self-reported home tests. Good question. So we are defining a case as an antigen or a PCR positive that was reported to DOH. So we're assuming that this is a big undercount because we're not counting home tests, but it has to be a positive antigen or PCR that was reported to the state. Does the data report home tests? No, we're not including home tests. We're not counting those as confirmed tests in any of our reporting. I think some of our teams are playing with metrics on over-the-counter tests, but right now those are not. None of those counts are included in our official case counts.
Yeah, thank you, Lily. You'll notice that most schools are really gravitating towards a take-home, over-the-counter testing strategy, distributing to families and staff members. So, yeah, curious to think about how we reconcile. And I mean, the schools who are on the call can speak to this, but it's so hard to figure out how to have people report those results to you, to the school, to the local health department. So thank you, Lily.
For sure. And that's where the hospitalization rates might be slightly more reliable. That's going to pick out the severe COVID cases. So we're shifting in general in surveillance towards looking at hospitalization rates just because we're more confident in those data. So yeah, just something to consider. But yeah, it's certainly a challenge that I think we're dealing with at all levels. Thanks.
Thank you. Kim, I'll invite you to the Zoom stage. I know that the data Lily just reported on is one of the many inputs that you are considering, that your team is considering as you work through the guidance updates. So would love to hear from you.
Hi there, my name is Kim Sanchez, and I am the Education Engagement Director for K-12 programs here at the Washington Department of Health. And so it's my privilege to be able to work with our internal teams that support schools in a broad variety of ways, as well as connect to our external partners, to schools, to OSPI, to the ESDs, with Health Commons, and all of our partners that work to support schools broadly in a range of programs. And so today I'm here to give you just a little bit of a preview and understanding of the work that goes into the school and childcare guidance, what the state of emergency with it ending on October 1st, what that looks like, and what that means for schools. So I wanted to start with just a timeline. And so as you are aware, we released our last iteration of guidance on the 5th of August. And then shortly thereafter, the CDC updated their school and childcare guidance. And then what that does is it prompts the Department of Health to look at that guidance and look at our guidance. And with one of our goals being to align with CDC to the extent that it makes sense, that we can support that piece and then look at where we are different and then make sure that where we are different also makes sense. We start to kind of put the two together and see what are the two saying, how do they fit together. On the 8th of September, Governor Inslee made his announcement about the end of the state of emergency, and we'll take a look at that here in just a minute. And I also just kind of want to point out for your awareness that we anticipate to release the next kind of updated DOH school and childcare guidance the week of the 17th through 19th. So I'll kind of show you where we are in the process and kind of what leads up to that next release. 31st, as you're aware, that end of the state of emergency, as well as an additional 13 different health orders, and it ends at the end of that day. And then we look at November 1st as this opportunity to, how do we take everything that we've learned, all the tools and strategies that we have, our approaches and our partnerships, and how do we really get proactive, protective, and responsive to circumstances as they evolve at the local level. So this slide really has a lot of words on it, but really essentially what it's saying is up until October 31st, the state of emergency orders allowed for the enforcement of the requirements that have been a part of the child care and school guidance. And then shifting on November 1st, what you'll find is that many of the requirements become really, the authority shifts from the state level to the local level. And what exists at that point are those permanent rules that are in place by statute or by state law. So this is just, as many of you are probably aware from either information that has been shared out or through the media, one of those pieces that will end on the 31st is the proclamation relating to COVID-19 vaccinations, where it applies to, for our purposes, where it applies in an educational setting. So that's for employees, for volunteers, and indoor contractors. Now, while this vaccination requirement is, the proclamation is sunsetting, it still is a best practice, and employers have the opportunity and the option to require that of their employees. What you're seeing here in really super small print, so they're just little tiny snapshots, are a couple of the other emergency proclamations from the governor that pertain to schools. And essentially, each of these relate to how schools maintain in-person learning by following Department of Health requirements and recommendations. And so these two also will be allowed to end on the 31st. So in thinking about the process of guidance revision, there's a lot of steps to it. And what you're seeing on the screen is are many of the steps. This is kind of an abbreviated version of it. But in this particular iteration, we start with reviewing the proclamations, looking at the WACs and the RCWs. And the reason why we go there is because many of these requirements that have been in place for such a time that what did things look like before that? So what are the existing state laws and rules that were in place prior to COVID? So being able to make visible and aware, how did we do things prior to this period of time? In addition to that, we've gone through the process of reviewing the CDC updated guidance. And again, as I mentioned before, looking at our alignment as a key priority. And in addition to that, we've had conversations with our senior leadership here at DOH to kind of highlight what are the kind of key direction points in terms of how to support schools and where might this guidance go. There's quite a bit of engagement and collaboration. As Sarah mentioned, this is a great opportunity, this network, in terms of collaboration with multiple agencies. And that process is utilized when we are looking at guidance feedback. Not only, this is just a little tiny snapshot of the partners that we collaborate with, but we utilize that feedback to inform the information that we're sharing out, because we know that at the local level, there are so many different things that come into play that trying to make it as accessible as possible. So then we work through the revisions, trying to simplify language, minimize confusion from feedback that we've received, and we'll hold work groups. We just had a work group with local public health. Then we go through the revision process, elevate anything that needs to go through senior leadership again before approval, and then we finalize and release the document. So you'll see this is where we are in the process as of probably the last edits I sent to Sarah this morning. So we're in the current kind of second draft, having had some of these work groups, and are working to prepare it in such a way that we can take those final questions to senior leadership. So what are some of those things that are not changing for schools? Or maybe I could also phrase that as like, what can you count on to be familiar? Because we know that a changing of guidance has been, is difficult, trying to kind of grasp what is new, what has changed. So the structure, the basic kind of content of the structure will still be there, but you may see some changes to the order of the information in there. As I mentioned previously, there'll be changes to maybe language that has been communicated to us that was confusing, and so we'll try to adjust for that, as well as you'll see that there will be additional alignment with CDC, but you'll also see that there are some differences there as well. Something else that's not changing for schools, and I try to highlight this because this was in place and existing in state law and statute prior to the beginning of this pandemic and will continue forward, is that working with and reporting to local public health. So what you see on the screen is the responsibilities of schools, and in the WAC, there's also layers of responsibility for other sectors as well, but working collaboratively with local public health in the investigation of cases, suspected cases, outbreaks, and suspected outbreaks. And that is for all notifiable conditions, COVID-19 being one of them. But what I would also really highlight from this, and I'll say this a little bit later on too, is really like a key takeaway that I think has been so critical over the course of all of our shared work is how critical our relationships are between our agencies, and particularly between schools and local public health, between the Department of Health and local public health, where we're really working together to support the needs of schools and those who are working and learning in those spaces. So there had been some questions, and I think I had previously seen a question regarding to cases. So I checked in with some additional colleagues here at the Department of Health just to clarify what these terms mean when we're talking about notifiable conditions. A number of questions have come up relative to the over-the-counter tests that are sent home. So a confirmed test is confirmed by having a PCR test. So that's what's considered a confirmed test. And that would be, again, for the purposes of schools, reported to local public health if a parent, caregiver, or grandma or grandpa identified that their student had a confirmed PCR test, or a staff member. A probable case is one that has had an antigen test that's been performed by a CLIA certified provider. So that would be considered a probable case, also something that would need to be reported to local public health. And then a suspect case is one that a test that is performed at home, so an over-the-counter test, or a test that's performed without a CLIA certified provider. So if an attendance person is calling home and to clarify and clear an absence, and the parent or caregiver says we did an at-home test, it came back positive, then that would be something that would be reported. So a suspect case is considered under these two conditions, but it wouldn't be something like I go into a classroom and attendance is being taken, somebody is missing, and other kids in the classroom say they're not here because they're sick, we think they have COVID. That is not something that would be reported to local public health. So that suspected case is based on the over-the-counter tests. So it's important to know, I know we've received a lot of questions that schools are responsible to report the tests that they are aware of. So when parents communicate that they have used an over-the-counter test, if there are tests that are done on site, if tests have been done with a provider, and you have awareness of those would be reported to local public health. And working together with local public health will help to understand like the best ways in which you're going to share that information, as it's different across the state. And then the other thing that I would point out is that it's going to be really important over time to continue to track L&I as well as Department of Health guidance. So another thing that's not changing for schools is employee notification for COVID-19 exposure. So that is, as long as there is a state of emergency, a national state of emergency authorized by the president, then this requirement to notify employees of a hazard in the workplace is still in place. So just to kind of flag to highlight for tracking L&I. And then the other thing that I would highlight is that at this space and time, the Secretary of Health's order for masking in healthcare settings is still in place, which would mean that school nurse office spaces, health rooms, if schools are offering or holding space for an isolation space, those are considered healthcare spaces. And so the requirement to wear a mask in those spaces is still standing. So that is in place as well. So I do see just a question. I know a few questions have come in, but I just see the one that popped up now. Are we to report hearsay? No. So again, the requirement to report is based on cases, suspected cases, outbreaks, and suspected outbreaks. So again, if a parent has told you that their child or a staff member said, I've taken the over-counter test and it came back positive, then that would be something that you would want to report. If someone has shared with you that they were told that someone took a test, that would not be something that you would report. Just kind of preview for this upcoming guidance. As mentioned in the talking points, many requirements for schools and childcare will become recommended best practices. So we've got a lot of tools, a lot of strategies that can help successfully mitigate the spread of disease. The remaining requirements are anchored in existing statutes and state law that have been there prior to and continue thereafter. But again, really want to highlight that active working relationship with local public health and know that the guidance work is well underway. So things are continuing to evolve and shift and move forward. And then lastly, I would just put out there that part of the things that are next for us as we continue to do this work is to look, in addition to emergency response and building these relationships to continue to be responsive, looking at the impact and the recovery piece and the ongoing impact of COVID-19 on schools, on kids, on staff. So you will see that we're continuing to collaborate with our agency partners and in terms of working on these shared priorities that we are absolutely committed to.
Yeah, thank you, Kim. Thank you very much. I love to see how dynamic and active this chat is. Please do not stop. That being said, we're going to invite our panelists to provide some reflections, but keep putting those questions in the chat. If we don't answer them today, we will loop back with you and we'll share them with Kim after this session. So I'd like to welcome Martin Mueller, Michelle Chung, and Karina McIntyre. Would be great to hear from each of you, and perhaps Martin, if you don't mind, starting with you. Martin, when you and I were first talking about having you join this panel, you said something to me that really helped center my approach to facilitating this, which is that I have my notes. Nothing is safe, Martin, that you say to me. We have the collective goal. All of us are trying to maintain continuity of education. And I think that that's so important. We're talking about COVID-19, COVID testing, COVID case reporting, but all of that feeds in to continuity of education. So curious, Martin, what else is coming up for you as you listen to the presentations and you read the chats that are coming in?
Thanks, Sarah. Appreciate the opportunity to be here with you. I just want to extend my deep appreciation to Kim and the full Department of Health team, and seeing Michelle on the panel here as well with the testing team. Just the amazing work that the Department of Health has done in our state over the last 3 years, and then in the school, generally, and then in the school space, this very flexible, creative, responsive initiative that we set up around testing has been so important for our schools. And I want to express my appreciation to all of you on the webinar today. You're kind of on that front line and just kind of seeing these questions come in that are very detailed oriented. The thirst that you have to figure out how to do it. That's kind of the message that I have right now. We're in our fourth school year, of COVID. And I think now more than ever, we need to be focusing on our core mission, right? And that's preparing kids to thrive academically, socially, emotionally, and preparing for them to successfully transition into adulthood. That's our K-12 core mission. And I think more than any time over the last 3 years, we're in a spot where that should be our core purpose. All this evolution of what's happening with proclamations and orders and requirements, we're kind of moving back to the spot where we were maybe pre-COVID, where we had existing laws to frame up what we have to do. But we've also built all these muscles, right, around response. We have this toolkit of things that we can do that we know are successful. Testing is an important one of those. You know, things like hands hygiene, ventilation, et cetera. We don't want to let those things go. And now we're in the spot to engage in those kinds of activities where it's really about what's our purpose in K-12. Why are we doing it? What you know, how is it organized around being responsive in school, in the community, so that we're meeting the needs of our kids and families. So the other thing I would say is, you know, it was so great to see Lillian walk through the data. And if you look at that and you go on the DOH dashboard, you'll see, I think, 6 spikes of hospitalization since COVID started, including the initial one. So a smart person would say we're probably going to have another one. You know, and we all should just be prepared for that. And that's the kind of thing, I think, where, as you guys are engaged in your mitigation work and the role that testing plays as a part of that, you know, continuing to refine your processes, continuing to be as efficient and accurate as possible. We're going to need that, I think, moving forward at some point during the school year, just based on what the data tell us. And I don't have any insight into what's going on. In fact, I'm super encouraged by the way that the data look right now, you know, compared to what we thought we might be seeing by the 1st of October. So, really, it's really organized around those kids in school walking in and us working with them so that they're safe, healthy, engaged, supported, and challenged every day. That's what we're doing, and we're kind of at this spot right now where there's not this external thing saying, hey, you have to go do this thing. It's really about the best practice. We've built the muscles. Let's use those muscles. Let's keep exercising them and meet our mission. That's what I was thinking, Sarah.
Yeah, thank you very much, Martin. I couldn't agree more. I really think the hardest part of implementing your testing program is over, and that was launching your testing program, figuring out how to do it. It is easier to continue maintaining it than it is to dismantle it and then have to ramp it up in a time of an emergency or an outbreak. Michelle, COVID-19 testing, this is your area of expertise. I'll give you a lowball question, and then of course, bring in any other elements you want to this discussion. Can schools still rely on Learn to Return and DOH for free COVID-19 testing supplies and the labor support funding that's available to reimburse them and their staff's time for testing activities?
Thanks, Sarah, and everyone. Hi, thanks for letting me join this conversation. I am the school testing supervisor for the DOH testing team. So our team manages the Learn to Return program, and we work very closely with Health Commons, ESDs, and OSPI to implement the Learn to Return program. Sarah, I think it's a lowball question. You may say that, but I think it's a really important question to answer. I think even with all the changes that are happening, I think we would want to emphasize that we want to continue providing COVID-19 resources to support schools. So given that, we are continuing the Learn to Return program with everybody that you see on the call today. We're continuing our work to provide for this mission to support you in COVID-19 testing throughout this school year. What that means is that you're continue to have access to COVID-19 testing supplies. Please continue ordering that through the school ordering portal. There's that process that's in place for that. I do also want to encourage that there's schools that are out there that are working with our school partners, vendors, to support school-based testing. That also remains. And you know, our representatives that are on today's call, either pinned here or on the call itself, from Health Commons and ESDs, they remain to be points of assistance for schools to help them refine that strategy and navigate through all of these changes. I think maybe we're really in lockstep with Martin, but there's some thoughts that I was thinking as we were having these conversations, looking at the data. I do want to say that I think most folks on the call know, like, testing does remain to be a really effective mitigation strategy in keeping schools open. And I think a lot of that is a testament to all the work that you've already put in to develop that muscle, build that infrastructure, really keeping our kids safe. And so knowing that we already have this infrastructure, and it's quite extraordinary what that looks like. It varies school by school, district by district. How do we continue using that infrastructure to be extended into longer term infrastructure that can be leveraged for future school priorities. Maybe one last thought I will share is whether or not something is a requirement or a recommendation. I do think that I think the major goal for our team, and extends to thought partnership with the schools, is understanding how we continue to champion and reduce barriers to testing access, knowing that it's been so good in keeping our kids in school and continuing the education journey, what that could look like in schools continuing for the school year, and how do we continue distributing testing supplies, if not in the school environment, but out to students and their families to use at home. We look to you to really helping us understand what that circumstance looks like in terms of reaching your communities and keeping them safe.
Thank you, Michelle. This robust infrastructure that you're talking about, you're humble with it. For folks on the call, Washington State has been elevated as having one of the strongest school-based COVID-19 testing programs and infrastructures in the country. Other state leaders reach out to our State Department of Health to learn how to replicate really the hard work that you all are doing to help keep schools open and safe. Karina, you're part of that infrastructure as a representative of the ESD network. You're based in Southwest Washington at ESD 112, but I know you're here today on behalf of all 9 regions. So I'd love to hear what's coming up for you.
Yeah, thank you, Sarah. I think that we're certainly entering a new phase of the pandemic, but we're very keenly aware that this is not over for many communities across our state, particularly marginalized and vulnerable populations. So while the state of emergency might be ending, there's still a need to protect our students and staff from severe disease. And reflecting on this last year, I think it's really about partnership. It's our partnerships across the state that have been key to our success so far. Certainly as an ESD network, we've been around to provide support and services to schools for over 50 years and will continue to be around throughout the different phases of this pandemic. We've worked very closely with DOH and OSPI, Health Commons, and local public health, and certainly all of you on this call will continue to rely on the infrastructure that's been mentioned. What we've built so far, we want to strengthen those connections and help schools connect with local public health in ways that we have not had to do so before. I think as we're entering sort of this new phase, it gives us an opportunity to position ourselves to be more proactive, more responsive to public health. ESDs can continue to serve as a liaison between schools and their local public health jurisdictions. As coordinators, we will be collaborating with our school nurse corps and regional school safety teams to support the post-pandemic planning in ways that's responsive to each region's needs and each community that we serve. And that might include things like supporting the emergency operation planning process related to public health, making sure that schools still have access and are connected to local resources like PPE, continuing, of course, to share the latest news and updates that we have about COVID and other public health issues. So I think, again, our partnerships is what helped us get through this last year and will continue to carry us forward, and ESDs can continue to be that bridge between public health and education.
Thank you, Karina. I'd love to have this group conversation be flat, be multi-directional, meaning the grid view on our Zooms. I welcome folks to come on video so we can start this group conversation. Really appreciate a couple of schools offering to help spark this group conversation. Gemma Kim, if you are online. Gemma is the Director of Health-Related COVID Response at Highline Public Schools. Gemma and I met each other almost 2 years ago when you started in this role at Highline. Would love to hear from you. What's Highline thinking about? Has this conversation sparked anything new for you? Anything else that you want to add to this group dialogue?
Yeah, I think this conversation is just providing a great opportunity just to reflect on what's been successful and what Highline has really valued throughout the past 2 years. And when I get down to it, Highline has, I've heard it's unique, a unique approach to how we're responding to COVID protocols. So we have an entire team dedicated to COVID response protocol for the district. So really any testing, reporting, guidance, review, all that is actually centralized to one team. And this has been really successful and really efficient in how we can provide truly equitable access to this information and these resources. So for example, and we plan to continue this, but for any post-exposure testing, we actually offer it right into our schools during the school day. So if there is a positive case, my team takes care of the reporting, takes care of the notifications, and then we can also go in and offer testing to the group that's been exposed. And this is the same case in any outbreak situations as well. And so really this is all to say that throughout this time, we've realized that, DOH, Sarah, Health Commons, they've all done so well with providing resources and making the resources available. But something that I say is, you can lead a camel to water, but you can't make it drink. So you can put all these resources in front of people, but that doesn't necessarily mean, one, that they know they're available or they know how to access them, et cetera. And so that's where my team comes in, is that when you have people dedicated specific to the work, that they can help with those one-off relationships, those direct relationships with people to access those resources. So COVID information at this point is everywhere. There's posters, there's web pages, everything. But the people in our community, specifically in Highline, may not have facilitated access to know about those resources. And so my team has phone lines, we have emails, we have everything to that, if there's something in the district that's people are confused about or need help with, then we can just connect with that family or that staff member directly to know exactly what to do and how to do it. And this has definitely been made possible through DOH funding, which has been really important to us. So that labor fund that has been accessible has made our team's work just that much better and that much more possible through that funding. And yeah, we really appreciated all the resources. And again, just those personable relationships to help people through, just allow us to, as Martin was saying, to get school staff to be able to do what they're meant to do, the teaching, having students in school, and my team can take on all the health side of that information. Nurses are already, nurse shortage, all that good stuff that we already know about. But with this added load, we can help take off that load and centralize all of our response.
Thank you, Gemma. Thank you for plugging the funding. It is still available. If somebody's ears perked up and said, oh, there's funding to do this, it's still available. Please reach out to your ESD coordinator or your Health Commons program manager. Gemma, something Highline has really excelled at from my perspective is centering equity in your approach. You go above and beyond when it comes to making sure your testing program is accessible to your diverse school community. There's a lot of languages spoken in the Highline school community. So if there's any school leaders on this call thinking, what can I do to make my program more equitable, make sure I'm serving historically underserved communities? Gemma, I hope it's okay if I offer you as a thought partner to them. Would love to hear from two of our school nurse colleagues over in Eastern Washington. Carrie Dinwiddie and Ruth Erb from Meade School District. We also met nearly 2 years ago. And speaking of the labor funding, you were the first school to apply for labor funding when it became available. Actually, Carrie piloted the application process. So those of you who have said, wow, it was such an easy application process, credit really goes to Carrie and her team for helping design that. Okay, Carrie, would love to hear what's coming up for Meade School District.
Thanks. Ruth, I think, is attending to an emergency, so she'll pop on if she's available. I think we're a first in a lot of things. Our district stayed open the entire time during COVID. Our school board voted to go back to school. right away in the fall of 2020. And so we've been open, and with testing, we had testing available in all 16 of our school sites. All of our nurses were staffed and was testing so much last year. We hope to never see another January 2022. That's kind of the benchmark. Like, do we compare it to January 2022? That it's not that bad. And so this year, parents, it's COVID fatigue is definitely being felt by everybody, parents, our community, our nurses, our staff. And, at the beginning of this year, we had a lot of, what, COVID's still around questions. And so it's been trying to balance that with our parents and our community. They definitely appreciate the choices that they have now versus some of the mandates that they had last year. The ability to mask or test, do a home test and not have to test at school. We've really pushed out the home tests to all of our families as much as possible to relieve the workload that the nurses have in the schools. I would say last year, 90%, if not 100% of our time in all of our health rooms last year was just COVID testing and everything that goes along with that. And so to be able to push that out to parents and families, has benefited not only our nurses and our health rooms and our schools from the busyness of that, but has also kind of given it the responsibility to the families. With that being said, we have to trust the parents to tell us that they're actually testing and what those results are. That's hard. As nurses, we want to have the control and we want to see the line or not see the line. And so we've kind of had to take our micromanaging out of it and let parents know what their requirements are, and then let them tell us what the results are. And then, the kids can come back to school. We've had to remind a lot of parents that just because it's not COVID doesn't mean they can send their kids to school sick. So we've had to review our basic illness guidelines that, just because it's not COVID, you still need to stay home if you're, too sick to be at school. So it's kind of re-educating parents on illness that's not COVID, in addition to COVID still being out there. And we're still seeing cases in all of our schools, definitely at a lower level than we were in the spring. It's just a different feeling this year. And I've had a lot of staff comment as well that it just feels more like a normal school year, probably as normal is going to feel from now on. Sports are going on. There's not a lot of talk in the sports world or the WIA about COVID. And we've just kind of had to let that go and let those sports teams manage it, however they're required to manage it. So, going forward, it's hard to imagine not having the testing be a requirement. But yet we don't have a rapid flu test. We don't require families to test for flu before they come back to school. And so, we're just waiting to see kind of what the Department of Health is going to have for our families. It's nice to have the rapid COVID tests available, but yet we have a lot of families who are over it and they just want to, keep their kids home when they're sick and send them when they're well and just kind of keep going on with life.
Thank you, Carrie. Yeah, you're highlighting a lot of the shifts that have been happening, are coming. What role does education and prevention and health promotion play? I want to write another grad school thesis. One more guest school leader who's agreed to share some perspective from Central Washington. We have Tabitha Myers. Tabitha is the superintendent of both Waterville and Palisades School District. Tabitha, I hope you don't mind me saying, but from my perspective, you are a school leader who has championed going above and beyond for your community. So looking forward to hearing what you're thinking, what's going on in your two school districts, what's coming up for you in this conversation.
Thank you very much. It really, it's been tough. So everybody here is a hero, right? It's been hard. So days have been harder than others. but I'm happy to share what we've done in our two schools. Certainly, we don't have this nailed down, but in Waterville and Palisades, we're in two very rural communities where we have also sort of seen a lot of challenges around COVID protocols, masking, testing, a lot of distrust of kind of government entities from the very beginning. That's been a challenge. So our approach has been to really try to create a robust partnership with our community while keeping our mission in mind as a school. So in our communities, in both communities, two very small schools, we are 30 minutes from the closest healthcare facility. And that has been a huge barrier for families to get tested, to get accurate information, or to really reach out for any guidance. And that's been true for many families, and especially I would say for families in poverty and bilingual families. And so we've tried to fill that void. So we partnered with our local clinic, which didn't offer testing during COVID. We have a small clinic in Waterville, but they didn't offer COVID testing, and families couldn't be seen at the clinic before they were tested and shown as a negative test result. So Waterville School stepped in and said, we will be the test provider. Our approach has been, if we can keep kids in school through decreasing community spread, we will absolutely do that. And that's been critical for us in the community that we're in, because without stepping in to fill those roles, many families were simply not accessing testing or information or PPE. So that kind of started us down a path of real partnership with the community. And the message that we've really tried to share with our community is that together, if we're all identifying cases and following the flow chart and processes, we can keep kids in school. And our community, even in a tough community, has really gotten behind that. So we have employers reach out to us and say, can you test in my business in this community? We'd like to test. We think we had a case. And we've just made that happen. We used labor support funding to be able to hire a COVID coordinator last year. And that person then coordinated with our nurse, administrators, and secretaries. In a small district, y'all know it's everybody's job. Administrators, myself, and principals, we offered weekend testing for people. We became kind of the test center for the community. So we had drive-through testing outside of the building, and then we've continued that this year. With that process, we have less demand for testing, but we still continue to offer drive-through testing. We also have become a distributor for over-the-counter tests when needed, really, for families that struggle to get those tests ordered. And so we really, for us, it's been about partnering to keep our whole community safe and doing whatever we can as just a cog in that wheel to try to get information out about vaccines, testing, COVID recommended activities. And, even if it might be a requirement for a school, but not an employer, we refer people back to the DOH guidance. So we have people call us and say, okay, what do we do? And we refer people back to the guidance, and we try to get people back to following recommended practices to keep everyone safe. It's been challenging, but I think also allowed us to rebuild some trust in a tough spot for us. We were the center of Unmask Our Kids Washington for a while. So we've really worked hard, and that's been our approach.
Yeah, thank you, Tabitha. Thank you for highlighting the unique context of being a rural school district in a political climate that is not instantly supportive of you going above and beyond to keep your school community safe. Thank you, everyone. I hope you all have a wonderful afternoon. We will follow up with items on the chat offline. Have a great day.